I am a practicing family physician and the Deputy Secretary of Health, but as a family physician, I am one of those that does happen to believe that the mouth is part of the rest of the body. And in my Deputy Secretary role at the state, I oversee 5 areas in my role. The one I'm going to be speaking about today is specifically the Health Innovation Center, which comprises our work on health and healthcare delivery system transformation at the state, essentially looking at new ways of paying for, delivering, and coordinating health and healthcare services. Over the past year, the Department of Health has been incredibly honored to be a part of what we call HIP for short, or Health Innovation in Pennsylvania, which is a governor-led, multi-stakeholder, multi-agency initiative to improve health and healthcare across the Commonwealth. Through HIP, over the past year, the Department of Health and our sister agencies have collaborated with over 200 stakeholders that represent a variety of perspectives in the health and healthcare delivery sectors to discuss changes that we'd like to see in a number of realms, including population health, price and quality transparency, payment reform, health information technology changes, as well as workforce that is inclusive of the oral health, behavioral health, and other workforces in addition to the physical health workforce. Through the design process that lasted over a period of several months, 3 priorities emerged during that planning process, one being in payment reform, the second being in price and quality transparency, and the third being in rural health reform. I'll describe each of these a little bit more in detail. First, in terms of payment reform, like many of other states akin to Pennsylvania, we are moving toward a value-based payment system, moving from volume to value. Much easier said than done, but we are embarking on this journey with many other states and territories across the country. One of the deliverables that we are soon excited to receive in this particular stream of work is what we call affectionately in the Department of Health the value-based scorecard. We have partnered with the Catalyst for Payment Reform, which is a nonprofit group that specifically is working with employers and with states to help make that transition from volume to value. They are presently researching and interviewing our public and private payer sectors to understand at baseline what percentage of payments in the Commonwealth are tied to value-based payment arrangements. The idea is it's similar to what Secretary Burwell has done on the federal level with Medicare, is that we will use this information to set a target, a percentage change in where we would like to move to in terms of value-based payments across public and private sector payers within a certain period of time. In terms of price and quality transparency, the main goal here is to make data more accessible to consumers, to allow them to have information to make more informed healthcare choices. We're very excited to work with the Pennsylvania Insurance Department, which is really leading the way on the implementation of several aspects of the price and quality transparency work. These include such things as consumer health literacy. The Commissioner of Insurance, Teresa Miller, is incredibly excited about coordinating and collaborating with our partners that are in the literacy space to create a state, a branded campaign around consumer health literacy that could include things such as how to compare different aspects of insurance that are very difficult to understand when navigating how to select a plan, and also how to understand as a consumer where it is that you go if you are afflicted with a certain type of injury or illness. Do you go to a retail clinic? Do you go to urgent care? Do you go to your primary care doctor? Do you go to the emergency department? These are just a couple of examples of some of the different types of literacy campaigns that we have discussed. And again, that committee just got underway. We look forward to those recommendations over the coming months. There's also a group that is focused on measures in primary care. So many primary care providers come to us and say, there are so many measures we have to report out to so many different types of payers that might be measuring the same thing, but they do so in a different way. And we're working with different leaders in this space to try to align those measures so that we're not having to report on so many different types of measures that are related but are different. In the rural health reform space, we've been spending a significant amount of time in this particular stream of work. The Secretary of Health, Karen Murphy, sincerely believes that no Pennsylvanian should be disadvantaged in their pursuit of health based on where they live, whether this is in a rural setting or if you live in an urban setting. In this particular stream of work, we have been examining new ways of financing care that are delivered at rural hospitals. We've also been exploring regulatory changes around telehealth and also examining new workforce models, particularly in the latter two, as I look forward to the recommendations that come out of the discussions tomorrow and the prototypes that the group will build. I would encourage you to think about ways to expand access to oral health care services and dental services, particularly in rural areas, thinking about applications of teledentistry and what it is that you think that you need, because we would like to hear what those recommendations are, as well as thinking about creative ways to tap into our workforce, either with new kind of newer models in the oral health space. We were talking earlier today about community health workers, or to kind of retrain or additionally train those that we have currently in out in the field, such as training my fellow family physician colleagues and me on oral health exams and applying fluoride and so forth. I just want to finish up with a couple of thoughts with thinking about the public sector being engaged in innovation. I understand that when we think about innovation, state government is not necessarily the beacon of innovation in many people's minds, but I will come back to you and contend that there are some factors that we offer that I think are very, very important to advance change with regard to health and healthcare delivery system transformation. One, at the state level, we do have the ability to create legislation and pass laws. We have regulatory authority, and we recently just changed some significant regulations with regard to telehealth to make it easier to expand those services across the Commonwealth. The state also has convening abilities to bring people together to talk across sectors. If you get an invitation from the governor to be a part of a committee, I haven't met anyone yet who has turned that offer down. So that's always a good thing to come together and talk across different sectors. And also we have the ability to learn peer-to-peer from other states that are going through similar types of initiatives as we are. So those are my thoughts I want to share with you. I'm glad I got through without coughing or sneezing over everyone. And I thank you for the opportunity to be here. It's been a fantastic format. I look forward to hearing the recommendations that come out tomorrow. Thank you.